Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars and pigmentation. I do a lot with collagen stimulation as well as facial balancing. I am going to have you kind of just see a slice of how I do acne scar consultations, and just when I see scars and when I see patients and I evaluate their skin, what exactly I'm going to be looking at as I look at it either in person or over a phone call with, or I should say, a virtual call, and where we're gonna take a look at your photos, and I share my screen and really showcase exactly what I would do for each of your kinds of scars and the different modalities that are needed. So I'll wait for a few more people to join us, but if you take a look over here, this is a patient with what looks like significant fat loss, significant fat destruction over here. And a lot of this is interesting because you can see there's at rest, the patient basically has this big indentation in the center of her cheek right here in the mid cheek area, and the lateral cheek there's a lot of atrophy as well. And then around the scars, there's a lot of this thickness there too. So you can see the thickness of the scars, and that's where really what I do a lot with is I try to smooth down the edges of these scars, and then also work on the lifting up those deep parts right there. So I'm going to walk you through how I would do this particular kind of case. This is a case that really I worked on over like 2.5 years in order to get improvement. I'll show you that progress in just a moment. But thank you so much, Mrs. Jones. Good seeing you on too. Thank you. And here we go. I'll show you. Look at this. What are these areas right here? These are boxcar scars, and what we want to do with these is we want to place a little bit of acid called TCA, and so we'll place that directly inside the scar. It's interesting because I was talking to a patient today, and it was a really, really interesting conversation. He's somebody I worked on a few months ago, and he's like super happy, super thrilled with his progress right now. And he had actually gotten burned before with the Halo laser. So he told me he got the Halo laser done, and it ended up burning his skin. And he had scarring, he had ice pick scars, he had some boxcar scars. And it's interesting because he was saying that he'd asked so many doctors what kind of scars he had, and nobody could just tell him what kind of scars he had. And that's actually funny, or not funny, it's sad at the same time, but it's interesting to me because when I was going through the same process, I found that people just didn't know what kind of scars I had. And it was pretty clear what kind of scars I had, but I wanted to hear it from a dermatologist, wanted to hear it from professionals. And they were like, oh, it doesn't matter, it doesn't make a difference. But it does make a difference. Like these boxcar scars, these ones that I'm putting these red lines in here, these are areas where we're gonna place some TCA. And that's an acid that we would place at the base of these scars to trigger a collagen response. So, it does absolutely matter. I mean, of course, we could place in other forms of scars. We could place in ice pick scars. We could place in rolling scars. But it's just important just to know that, okay, here in this process here, some of these I'm actually placing in some of these rolling scars as well. And we need to be aware of what it is. So we could know the concentration of the acid that we're placing over here. We need to know that, okay, we could put some of the acid on the edges of the scar wall as well, and that could help soften up the edges of the scar. We could put a different concentration at the base of the scar to trigger a collagen response. That's really important. And you can see when you're looking at this, a lot of people will just not even pay attention to something like this, where they won't notice that there's this thickness around the edges of these scars. Hi, Mahia, how's it going? So there's this thickness really around the scars, and that's look at this. When you look at this really closely, you'll see this. And if you're somebody who looks at your skin and you see this kind of thickness, you'll understand exactly what I'm referring to. So this patient who I'm talking about today, he had some of this thickness, and they were just doing Halo laser on it, and it ended up burning his skin. And he's a Hispanic patient and was really upset about the fact that they did that to him, trusted that, they'll be safe, and they ended up causing significant pigmentation issues, and he felt that his scars got worse. So this is important to pay attention to. Look at this, the wall thickness is really important. So I'll show you what I'm referring to again, really with this, this process. Let's just go back to, I'm going to put it zoomed in again. And hopefully you guys can see this again still. So take a look and see, you can see this thickness wall. Look at this all along over here. See this right here? So this is where we have to smooth it down. So someone was asking about phenol peel. This could be a phenol peel patient. If she has a downtime recovery process, she could do a phenol peel. And we would essentially use a phenol to stimulate collagen production. And then it also is really nice because we could create a layer there where we then can actually use dermabrasion, so mechanical tools, to sand down this whole thick part right here. Like, think about this whole part right here. We could sand it down. I'm not loving this thick ink though. Let's see if I could reverse that. Okay, so let's see. I'll try to go back here. Okay. So if you look at this, this is interesting because it's like clearly you have to really smooth this down. And what I was talking about is dermabrasion. You need something that's going to be mechanical. You need something that's going to be really strong to do that, because it's not going to smooth down with a fractionated laser, not going to smooth down with a halo laser. And someone's asking, is Halo not a good laser for acne scars? No, it's not a good laser for acne scars. It's a pretty poor choice for acne scars. Things that are rolling devices in general are just not great. It could lead to more scarring. Like that patient today I was talking about, other patients that I've had who've informed me, patients in the comment section who've told me as well, that the Halo laser made their scars worse. And it's partly because it's a rolling device. You shouldn't use a rolling tool on these kind of scars. It can end up actually causing the scars essentially to widen for certain kinds of scars. And then sometimes it's just essentially too much heat, too much energy, and it's not focused. So imagine now if you're just rolling this around and you're not actually targeting the proper thick areas of the scar properly. You're not working on this area. So this right here needs ablative CO2 laser. That needs an ablative CO2 laser or a phenol peel with dermabrasion. So what I mean is ablative, because we need something with a lot of heat, a lot of energy to actually really contract that tissue, bring it down. We really want to actually remodel that skin, really stimulate more collagen production over here. You're not going to be able to get that with something like a Fraxel laser or a Halo laser. It's not going to help out enough. Is he going to tell me how to get rid of it? I'm telling you right now how to get rid of it. I'm talking about it right now. I'm explaining exactly how to get rid of it at this point. So I said these red dots are TCA CROSS. Those are areas where we're going to place a little bit of acid and we're going to trigger a collagen response like that. So directly at the base of that. Tylen is saying the Halo laser, oh, good seeing you on, by the way, Tylen. Tylen is saying the Halo laser made my acne scars worse. That's for sure. I'm surprised my derm did it on top of existing cystic acne. Yeah, it's actually interesting that that's actually something that was pushed. And the truth is that it's not really just the practitioner's fault. It's really not. It's these companies that are pushing these devices and then getting people to believe that these are cures for scars or cures for whatever condition that they're trying to treat. And they have people just, these physicians that are salespeople that will try to push it on you now, because the device company then will say, hey, if you don't believe me, why don't you talk to a doctor who uses the Halo laser or uses something like Moxie laser or so, and they'll convince you that, oh, that's an excellent tool for scars. And they get a kickback off of it, and they don't tell you that. And look at Tylen saying that the Halo laser made her skin worse. She says that my skin used to be dry before Halo, and I noticed it got incredibly oily after Halo. And I heard that a few times, where some patients also said they got more scarring. So that's interesting. Hi, Lucky Singh. Good seeing you on. Lucky Singh is saying, hi, Dr. Qazi. I hope you had a beautiful time honoring your sister on Monday. Appreciate you, Lucky Singh. The way you carry her forward speaks to the depth of your connection and the light she brings through. Appreciate you so, so much. And he says that you're an incredible brother and physician. So thank you so, so, so much for that. Appreciate you. Let's see here. Alex Carter saying, I plugs my pores my whole life from washing with water. It gave my nose a smooth look. I had foundation on. I popped some out and I tried not washing my face to grow the plugs back. But the pore is large now. It's basically like a large pore. It's not an ice pick scar. But you could use TCA CROSS for that. And that's what I'm referring to over here. These red dots are TCA CROSS areas. And again, this thicker area right over here, this is an area that we would use more of the ablative CO2 laser. And then what we need to do is we still need to break up the scar tissue inside here. So what we have to do in here, and I'll just want to reverse this red area right here. But essentially this whole process over here, we're going to have to actually go inside this area. and actually undermine that scar tissue and break it up. We got to actually break up that scar tissue. And I'll explain why. So I'll show you something here. So this is your scar. Hopefully you guys can see this color. If you can't, let me know, because it's hard to constantly change colors apparently in this thing. But think of this as like your atrophic acne scar. And these are these tether bonds over here, okay? So these are the tether bonds, and then you have just right underneath over here your hypodermis area where your fat is here too, okay? So a lot of times the fat is destroyed, then you can see all along over here, you can see all these tether bonds. So what we want to do is actually sometimes just go in here and actually break up that scar tissue. We break it up, and you can see it's pretty, there's a few. So what happens sometimes, and actually this is important too, what happens sometimes is that people go and they'll just start breaking up this bond, and they're not understanding that there's a whole mesh, there's a whole network of other spider webs all along, and they sort of just like, oh, okay, I passed it, and now this is, I think of this as three-dimensional, that they're missing now, and they just kind of just slice through, and they miss these other bonds here. And it happens over and over and over again. And then they say, well, you have to do 6 subcision sessions in order to get any improvement because, you know, there's like retethering. No, it's not retethering. It's just that you missed all these other bonds. So you missed the bonds, and then you are now forcing patients to do an aggressive treatment again because you missed it. And so that's what ends up happening with that. So we said we go through and really meticulously break up that tether bond. Now, let's say we break it up. What happens now is that essentially it goes from there to potentially a little bit more shallow. And as it's more shallow now, it's like basically those bonds are broken up. It's lifted up a bit. It's not quite back to normal yet, right? Why is it not back to normal? Because there's fat loss, there's fat destruction. There's clearly fat loss and fat destruction in this patient. You could clearly see the fat destruction all along here. Look at that fat destruction here, the fat destruction all along over here. This is significant fat destruction here. Look at that significant fat destruction here. And you'll see over and over and over again that patients will say, well, you know, you know, I don't want to do filler. I'm worried about filler. I'm worried about volume. You know, I've heard terrible stories about this. And really, it's like interesting because when you look at this, the thing is, even if you break this up and you lift this up and you try to smooth it down, you're still going to get this indentation here because of the fat loss. And that fat loss is like significant in this case, like I said, right? There's clearly a lot of fat loss. So we do want to actually put a lot, essentially at some point where you need to do some volume. And you can see in this particular patient, I'll show you in a little bit, that we ended up doing that. We ended up smoothing it down and revolumizing her over the course of 2 years or so. And actually, I'll show you, I'll give you a sneak peek here. You can see, look at where I was, look at that. And that's about 2.5 years worth of work. So you can see that clearly revolumization, smoothing it down, doing that subcision part to allow that layer improved quite a bit. But I'm going to go back to this process here. And for those who are like asking questions, I appreciate your questions. I'll get back to them. It's not that I'm missing it. But I will say, though, that the people that are being particularly rude about this, you know, just like skip it and like, you know, just don't bother coming. Because I'm just explaining this to people that are interested in it. So, you know, and it's like my show, and we'll just kind of go through it. Because I think this is really important, because I think this is like, you know, to me, there's a lot of questions about how to do this, how it works, and there's so few people that diagnose this. There's so few people that go through how we do this type of thing. And I want to demystify this whole portion of things because it's like very, very confusing. It was confusing for me when I was going through it, and it's confusing for a lot of patients. So it's like you look at this and this whole chunk, look at this whole chunk of scar tissue. This whole process over here is just missed by so many people. And they're insisting on doing fractional lasers, and they're doing it over and over and over again like that. And they're never going to be able to smooth that down enough. They're just never going to be able to do that. So it's like, you know, how are you going to do this? You have to use stronger tools. So there's something like a strong phenol peel potentially, or a ablative CO2 laser. Those are the ways to improve that particular area. But now I don't do that kind of aggressive laser in this atrophic part. Like, what would be the point of me to do that right there? Why would I do that there? Why would I go and bulk heat all this area over here? Why should we do that? And that's actually something very interesting because a lot of people will insist on doing this for collagen stimulation. They'll say you have to use a lot of heat, a lot of energy in the depth of the scar because that's where you stimulate collagen. Sure, but I'm doing that with TCA. We're doing it with other tools to be able to stimulate that. I just never found that laser by itself stimulates enough collagen to make this area rise. It doesn't really happen that way. You have to flatten the scarred areas around it. Look at this whole area around it. You gotta flatten that area around it. And this patient, I'll show you again, but this patient, basically, it took a couple times for us to get to this because she's a Hispanic patient. She also had some hyperpigmentation after we did it. And we had to make sure that her skin healed. So it took a while for her to make sure her skin healed. It was safe to do. And then we ended up doing it. We had to do another ablative laser again. We had to do it. So it's like, there's ways of doing this really, really clearly that's safe and effective, but it sometimes just takes a long time for people to do it. It takes a long time. And so I'll hit some of the questions because I know a lot of people were anxious. I'll go back to, I'll showcase the photo that I had actually underneath here. 1 second. Let's see, where is that? Okay, let me do that. So this was the same patient here. This is where we were. Okay, perfect. So yeah, take a look at this. You can see this is this patient, the same patient. There was a lot of atrophic area. There was a lot of atrophy there. And there was these raised areas that were there. It was very, very complex to get this. Very, very complex. So over the course of about 2.5 years, we had to get this. Over the course of 2.5 years. Let's is saying, when you do phenol peel, do you always do dermabrasion as well? For scar patients, almost always, yeah, because we're doing the phenol in more severe cases. So yes, for scar patients, it is. Tylen's asking, what are some of the less obvious things that can impact collagen regeneration and healing? Well, diet for sure, the sun exposure for sure, UV light exposure, that's huge. But also, interestingly enough, also water. They're not just like your intake of water, sure, like that's important. But on top of it, actually just what we're splashing on our face. There's so many chemicals. The way the water is in this country is just terrible. It's a terrible process, actually. Nobody's ever solved the fact that our water quality is just garbage. There's so many minerals in there. And it's unfortunate because if you're in poor areas, you may actually find that the water quality is a lot worse. So water, actually, just splashing water on your face multiple times a day also is not a good idea. People overwash their face sometimes. They overly dry their skin. And that's something to pay attention to. People with acne, there are a lot of times they're told that their skin is just dirty, and that's the reason why. And so they start pushing a lot of skincare products on there, but also washing their face multiple times with mineral water. That's basically like just hard water on their skin, and that could be a problem. What's the best treatments for skin of color? So Godstar is asking, the best treatment for skin of color is going to be more of these kind of combination sessions, not just typically just like by one thing by itself. You have to do a few different things really to be able to get the best possible result. You're not going to be able to get enough improvement with just lasers and energy devices. You really should do a few different steps, not just lasers and energy devices. Yokana saying, I wish I came to you. I did laser and it came out just okay. Well, I'm still around. We'll help you out at some point. I know what it feels like, though. I do hear you. And that's exactly what I'm referring to with a lot of this stuff is that I don't focus so much on like, oh, well, there's just, one particular issue with one practice, or there's like a one particular issue with like, whatever else is a physician or so. That's like, I'm not even interested in that, to be honest. I could care less about what a lot of people are doing with these things. But the overall system is the problem, that it hasn't changed. In fact, I did this, my own treatments, 2003, 2004, and they were useless for me. And they still recommend the same kind of treatments, the same Fraxel laser combo with microneedling. And then, later on, after I was done with all that, then they started adding like PRP, and they were insisting that PRP would help it. And that was a difference maker and things like that. And it turned out it didn't end up, it wasn't the case. There needs to be a lot more of a meticulous approach to these scars and taking a look at it three-dimensionally. Let's see here. Can we use fractional laser without subcision and TCA CROSS at home? I would say that it depends on the kind of scars. Fractional laser, just like as I keep saying, I'm not a fan of that. but it depends on the kind of fractional laser. If it's more for like just mild texture issues, sure, that's fine. But if it's like something like this where it's really thick around the edges, then it's not going to be enough really to improve it enough by itself. But sure, it's good if you combine it with like TCA CROSS or potentially Subcision, volume replacement, all those things. And thank you so much, Lucky Singh. Really, you're such a good guy, actually. Thank you so much. Alex Carr is saying, so TCA won't get any results without Subcision first, or can you grow skin upwards with TCA CROSS without Subcision? As high as it would be with Subcision, it will just take longer. So Alex Carter is asking if you need Subcision with TCA CROSS. You do not need Subcision with TCA CROSS. There's a lot of patients who I just do basically just TCA CROSS. There's some patients that do TCA CROSS with lasers. Some patients that do TCA CROSS with Subcision. Again, it's exactly what I was referring to earlier with this particular kind of patient, the kind of scars they had. We had to do a few different things, but that's not everybody. That's not everybody that we have to do it that way. So it really all just depends on what we're seeing with the scars. You don't necessarily have to do something that's that requires Subcision or invasive procedures like that. Let's see here. Would a perfect fully ablative CO2 or dermabrasion for smoothing down rolling scar walls? It may take a few steps. It may take a few steps to do that. It may not be enough really to be able to do like I had to do 2 bigger CO2 lasers for this particular patient, fully ablative CO2 lasers for this patient. Ultimately, we did get pretty close to fully smooth for her, but it did take a lot of effort to get there, and then we had to lift up that scar tissue, which took a lot. I mean, the skin inside there, the depth of that scar, that's like a lot of that's just like scarred tissue that's not going to improve. Even if you just keep on slamming it and slamming and slamming it with laser, it's not going to change too much. You got to remodel the tissue around it. You got to revolumize it because the fat cells have become scarred. So there's a lot of things that are involved with it, not just with the fully ablative CO2 laser or dermabrasion. Tyler's asking, what types of food do you recommend eating lots for maximum collagen production? I think there's a lot to go through with that, but the biggest thing is I just say the easiest things to do is to avoid inflammatory products like dairy products. So avoid things that could prevent collagen production more than just focusing on things that can maximize collagen production, if that makes sense. So things that potentially prevent collagen production could be products that are going to be more full of just like complex sugars. There's also things that I'm looking at really also would be seed oil that really could potentially be something that's also inflammatory. Paying attention to that, I would think will be a better place to start because there's so much junk that we're given for food, and starting with like just knocking out all your junk food. Starting there, and then you can see, okay, collagen stimulating products. To be honest with you, the Korean and Japanese diet is very high in products and food groups that do stimulate more collagen. And I think it's pretty clear when I always say that I find that certain ethnicities do have a faster collagen response as long as the acne is under control, as long as other things are equal. A lot of times they do have a lot faster collagen response than other groups, and a lot of it may be due to their diet. So taking a look at this, where you essentially less inflammatory products, less things that are at nighttime, especially. I personally, when I was 21 years old, I just stopped having much carbs at nighttime. It helped me out a ton. And I think it helped out my skin a lot. So maybe something to consider. And it's actually a lot easier diet than a lot of other diets out there. A lot of things are like that. Let's see here. Yappers Anonymous is asking for some advice. I missed your question. If you could ask me what it is, I don't know what that was. Let's see here. Lupe is asking, would you recommend Pico Laser for dark underarms? What is the estimated price for Pico Laser? Our prices are online, actually, at drqazi.com. I don't know what the price offhand is, but yes, we absolutely could do that for that. We absolutely could do that. Let's see here. Melly's on here saying, Melly, from today's meeting, I did find a direct link to melasma and estrogen. Yes, exactly. That's exactly correct. Melly noticed that when she was placed on estrogen, that her melasma started to come out. And that's really important, really. That's really something common. And that's something that I talk about also. Estrogen can also increase with adipose tissue. So basically, the more weight you have, the more estrogen you could also have with that. So that also could potentially cause more oil production, which is a problem. Y'all listening, I did Fraxel 2 times with no results. Should I have done more? No, I mean, it's not, even if you did a bunch of them for your particular scars, it may not have been right. Let's see here. Hi, Dr. Qazi. Which laser can I use for scarring from a rock? Well, it depends. I mean, what kind of scar is it? Sorry that ended up happening, but there's a few different options there. Appreciate you, PK Farnsworth. Good seeing you on. Cookie John is saying, hi, doctor. If someone gets pimples after finishing isotretinoin, when should they start a second course? Is low dose enough, and how long should it be? Well, I mean, definitely start with more topical, like tretinoin. Just start with that, or some sort of retinoid, before jumping into isotretinoin. So start with topicals and make sure you get that under control first. Corrine is saying, these look exactly like mine. Does this have the ability to shift your facial fat if you have a naturally full face and want to preserve it? That's my fear after reading so many horror stories. So that's a good question, actually. That's a really good question. It's actually good to point this out again. So I'll go showcase my screen again. Let's see if I can go back to that thing. Let's see. I'm getting more advanced here. Okay, so here we go. Okay, so you can see with this process here, there's this fat destruction right here, as we were talking about. And when there's this kind of fat destruction, so there's a few things here. So there's scars right here, for example. This is fat destruction. It's also tethered, right? It's tethered and stuck. So what ends up happening, though, is that along the lines around it, around over here and over here, this area right here is stuck. So right here is all stuck. This basically starts putting too much tension on these lines around it. And you normally naturally have little lines. They're called Langer's lines, and they're all over your face. And they go like this in this part of the face. They'll go like this. And I use them all day long, all the time. These Langer's lines, all the time. I love them. And you look at this, and you'll see that if there's this big indentation right over here, like you see this big circle indentation right here, that what ends up happening is that it's pulling down and it's stuck. And the area around it, the tissue around it gets thicker. And then around it also, essentially, it's shifted your smile. You can't smile as full as you could have. You don't have as full of a smile now because you should have actually been smiling fully all along over here. But now what happens right here? It gets stuck. It gets stuck right here. And it doesn't actually allow you to contract as fully as you could. And now imagine years after years after years, decades after decades after decades of doing this, and that's when you start getting this kind of thickness around here. You get this kind of thickness. And then in other areas, let's say, for example, right over here in this portion of the face, this starts getting lax. It starts getting loose because it's basically constantly pushing. It's constantly pushing, constantly pushing, constantly pushing. And it's like, I want to smile, I want to smile, I want to smile, I want to smile. And it can't do it because of the tethered bonds over here. It can't do it because of all that. So there is tethering right here. There is fat destruction over here. And it's not allowing this particular patient at this time, when at this point in this photo, to smile as fully as she should have. So already it was causing a complication where in another 10, 15 years, she would get, and she may have already started getting some of that, she may start getting some sagging. So just from scars, just from this process right over here, this tethered area, the areas that are so stuck right over here, we may actually have a process where she actually ends up getting a volume loss, of course, but on top of it, shifting of fat pads and loose skin. So she gets jowling then. She also actually, sometimes you could see, in this case, for example, this is occurring in the cheek area right over here. And what ends up happening is that this whole process right along over here, this is supporting, you can't see it right now, but it supports her under eyes. So years and years and years of this fat destruction over here. Now the under eye area starts to pull down. All that starts to pull down. And it's like just having scars, just having acne by itself. Look at the pathology right now. Look at this. Look at all the consequences of having, first you had acne, and then after acne, you had this situation, and you now can't smile as fully as you can. Remember, you can't smile. Like you can't pull it all the way over here. And you can't even do the expression that you're trying to do because of that fact that it's pulled down. And when you try to do it, you're like, yeah, I'm so happy in life. Everything's going so well. I'm going to smile really hard. And now this area starts to get looser. So the reality is that just having acne, just having it can lead to scars. The scars, if they're severe, can be tethered and stuck, and that can cause it so that your fat pads get shifted, you get laxity, you get loose skin, you get jowling, you get a whole bunch of complications just from that. So that's just important just to recognize. Now, what does that mean now for our purposes? Now, it means, though, that when we're doing these things, we're trying to restore this area to allow you to smile fully. We're trying to get it so that you could actually express yourself better, but it has to be done safely. There's ways of doing it safely. I show it over and over and over again that I'm not in favor of doing subcision particularly deep. I believe in doing it really precisely, really, really carefully. And if, as long as we're doing that, as long as we follow those rules, as long as we are working on it, we're really conscious of it as we work on it. And I always am. I'm always just like very careful in breaking it up really meticulously. We will be able to release these bonds and then allow patients to actually age the way they should have aged if it wasn't for the fact that they had acne and they had a genetic predisposition to scarring. And this is a genetic predisposition. These kind of scars are not due to really just anything. Patients will say, well, it was because I picked, maybe one or two of those scars would have been picking, but there's a lot of people who pick their skin. I'm not saying to pick your skin. I'm just saying there's a lot of people out there that pick their skin. And it's not because you are just, picking your skin. You likely had an immune response, which you're genetically predisposed to have. And it caused a significant destruction of not just the acne, the bacteria, but it also destroyed the collagen of your skin, also destroyed the fat as well. That's the pathology. That's what we actually are looking at right over here. It's much more complex than, okay, well, it's just like a situation where you just have to do tretinoin, as I see people on here, things like that, just to solve this. There's a lot more that's involved underneath the tissue in order to solve this. And it's not something that really is particularly taught the way it should have been, or people don't pay as much attention to it as they should, despite the fact that it really does affect people catastrophically. Really, take a look at this patient. She couldn't express herself the way she normally should have expressed herself, and it's because she suffered from something when she was, essentially, I think when she was like 12 years old, she started having acne or so. And think about that, for like severe cystic acne by the time she was 12 years old. And it's so ridiculously unfair that in her 30s, she ended up still having significant scarring. She couldn't age the way she wanted to age. So of course we need to do something with that. Of course we have to do that in the best possible way. Let's see, Thailand saying, do you think there needs to be more transparency about what real human skin and texture looks like in the digital space? Yeah, of course. I think that with artificial intelligence, there's a lot of things also that are making it that's gonna make it look like it's more real. And the problem is that people are going to think that that's what you could achieve, and it's just not something that you could really achieve. I'm never going to be shooting for like this full perfection in myself or other people. It's something you really should not try to shoot for. What we're trying to shoot for is just to make this less visible, to allow you to age the way you should have aged. That's the point of all this. That's what we're trying to do. So they're saying, doctor, why do you use Accure and not AviClear? There's a lot of different reasons. They both have a similar wavelength. I think that, this is one of the things that I was talking about earlier, which is that the way that sometimes these businesses do things is that they push these products on people that aren't comfortable with managing the complications or managing the conditions. So they push products like AviClear on people or things of that nature, on people that, didn't know how to manage active acne or the bacterial component of acne. And it couldn't have gotten worse. Actually, the patient I just worked on 2 days ago, she had done AviClear, just yesterday actually. She had gotten AviClear done, and she said that it made her scars worse. She got new acne, cystic lesions, and then she ended up getting scars. It wasn't because of the laser. I'm not saying it's because of that. It's because likely she went to somebody that didn't know how to manage the flare-ups that could occur with any treatment, and then they didn't know how to manage acne because it was basically pitched as if it was like this end-all be-all cure for acne, and you don't have to do anything else. But you do have to do things. You have to manage the bacterial component of acne. You got to really pay attention to what could happen and what could lead to scarring. So there's that. The other issue is that with Accure, I like the fact that I got this real-time feedback. But there's, I'm open to if they ever fix like some aspects of AviClear, they ever change certain things. I'm open to a lot of things with lasers. I'm totally just want the best possible results for patients. I just care that patients don't have to suffer from acne, then don't have to lead to get scarring. And that's what I really care about. Like today, patients were saying, which one's better, Accutane or Accure? I can't say that, one's better than the other between Accutane or Accure. It's just that it's nice to have another option that really works incredibly well and normalizing oil production. And it doesn't have the systematic side effects that Accutane does. So that's what's awesome. It's not, whatever you end up doing, just do it just so you don't get this kind of scarring. The whole point is we could avoid these scars. Do you think you're close to done with your own scar and acne journey? No, I don't actually. I will at some point do it actually. I will do it at some point. When I have a little bit of time, I'm going to do a little bit more, and maybe I'll film it. you'll see. You'll meet Maddie, and she'll do some TCA CROSS and some laser on my face one day. Do you think over time there's more you want to do? Your skin looks great. I appreciate you, Thailand. But yeah, I do think that there's a little bit more improvement that I'll try to do. And, sometimes I see it in like the changing room or like in like an elevator, just a little bit of it. And I'm like, it'll be nice just to kind of soften it up a bit more. And it'll be nice to get that so that it's just, a little vlog. I'll try to do a vlog of my journey. Which I think, honestly, it does help to have this process. It's like, to go through it. It really, really did help me. It helped me understand what you guys go through. It helps me understand. I was able to understand a lot of like pain control better that way too, because I realized when I was doing it like, 20 something years ago with topical cream, just didn't work. It didn't work. It did not work actually at all for the treatment. It was like my face was on fire, and I did it 6 times, and my skin was on fire, and it was like it was terrible for my face. So I realized that I'm going to just do more like direct with nerve blocks, and it worked out incredibly well then. So that's part of the reasons why I did it, because I was like looking at it like, man, this topical cream does not work. The other thing I realized with topical creams actually, which is interesting. So the topical numbing agent that everybody just like tries to use and throw at people, and people are shocked that I don't use it. The thing is that it actually could sometimes make it so that the skin appears a bit more swollen. There's a little bit of swelling. And now to most people, they'll say, well, it's not enough, it doesn't make a difference. But I'm trying to be extremely precise as I do this. I'm trying to be exactly where we need to be. And so that little bit of swelling will throw me off. And so I wanted like exactly where it needs to be. And that's why I don't use that topical numbing agent, which is useless anyway. So it was super painful with it. So I didn't even recommend it. So yeah, I mean, I do believe that actually like there's a lot to still learn and improve, and I'm excited about that. Nor is saying the only place that healed my face was finding true peace. That's awesome that you were able to do that. Yeah, finding gratitude and true is really, really useful for you as well. What fellowships allow locum tenens? Did you do a fellowship for your specialty? No, I didn't. I'm not sure what you mean by allow locum tenens for. I guess you have to rephrase that question, Javon. Yapper is saying, how do you feel about Winlevi about treating acne before fixing scarring? I think Winlevi's kind of, it's okay, but it's not the best treatment. A lot of people also find it a little bit more irritating. Spironolactone is so cheap. It's just $7. I know it's an oral pill, but it's just $7, typically $7 to like $18. So it's really like, useful. And so use that instead. That's what I would recommend there. Let's see, your Yappers is saying, I already answered that. Hello, Dr. Qazi. Can Rejuran S be beneficial for any kind of scars? I have a lot of patients, maybe someone on here potentially even says it. They say that, it didn't really help them. Rejuran did not help them for scars. It was really painful too. I'm open to it. I'm open to trying new things, but I haven't heard like great things about it though for scar purposes. What if you can't take spironolactone? Then you may need to do Accutane, or you could do that Accure laser, which doesn't have any other side effects. Maybe consider that. Do you have any office in New York City? If not, any doctors you recommend? I just am over here in this country, so I'm just over here in Newport Beach, California. I have a lot of patients on the East Coast, a lot of patients from New Jersey, New York, a lot of patients, and they've done a lot of different procedures in New York City. And to be honest with you, yes, this is a real live, Tanya. It's really me. But they've done a lot of different treatments, and they didn't find that it really helped out. They just say that really things didn't really improve their skin. They were sold huge packages or treatments that just didn't end up working. So I can't really recommend anyone that I personally know or that I've seen, to be honest with you. Alex saying, someone on Reddit said their excision scars heal the same shape as the scars they excise, but that could be for other reasons maybe. Yes, it's possible that, at least only say the same size, but sometimes with oil production still, it may still not heal completely. If you still have oily skin, it may be it may still be a case where it gets a little bit dilated, and it needs to really have it where it's an environment that allows more collagen production. And you could do like silicone tape on top of it, when that should hopefully help as well. So something to consider, but not all scars need to be excised. Not all ice pick scars need to be excised. There's a lot that's still there. How old am I? I am almost 43. Let's see here. Where is it? It's kind of interesting. Medicine's like the only field out there where it's like, people want people not to be super old, not to be super young. It's kind of an interesting type of, whereas a lot of other things, it's like, it's okay. But like medicine's like one of the only fields like that. It's like very, very age specific. Like there's a little range there. Let's see here. Where was I at? Juliana saying, I've lost weight after subcision and filler and it felt like I had no results. Now I gain weight and my scars aren't that deep. So it sounds like you need volume replacement and do more volume replacement. You did a little bit of filler, but do more. Do some more. Does that mean that a facelift and fat transfer would need to be done at an earlier age? Potentially, but you may just avoid that by breaking up the scar tissue. Break up the scar tissue and that could help it. See here, after residency, you work as an attending. If you do fellowship, can you do attending and fellowship? That's related to locum tenens question. I'm not sure what the relationship with locum tenens and attending a fellow is. I'm still very confused with what you're referring to. So those who don't know, locum is like what we could do is basically like side gigs. You know, people or like physicians could just like work in hospitals or so, and they go around like the country or so, and they could work at locum tenens. But I'm still very confused about what the connection is that you're talking about, Javon. So again, I think you have to rephrase that again for me, please. Sana saying, hi, Dr. Qazi, I booked my consultation with you, but can I book an Accure before separately? Yeah, awesome. Just go ahead and book that, and we'll be able to evaluate you and see if what we could do with the scars at some point too. But absolutely, just do that. If you feel like you have oil production, you feel like you're getting acne, absolutely. And a lot of patients do it that way. It's actually a really smart move because it may be hard for you to get directly with me right away. So instead, just like already knock out your acne. By the time you get to me, it's like we're going to work on your scars. And I do the scars start to finish. I'll do it start to finish there. Karine is saying, is it safe to perform subcision on the temples? I know we have veins there. I do blunt cannula subcision there. Blunt cannula. I don't do blades typically. Maybe a small little localized area there, but typically I'm not using blades. Definitely I don't use Taylor Liberator over there. But, blunt cannula, it's actually not as tethered or stuck. Vast majority of patients, not as tethered or stuck as you may think. It's a lot easier to break up than people say. I'm kind of shocked that anybody needs like sharper tools in that area because it's usually pretty easy. But, I don't know. Maybe someone's case is really tight over there. So it's not too difficult. And then you just need volume. It needs a lot more volume over there. There's a lot of fat destruction that happens really quickly. Yeah, awesome. So for those who are asking about how you could book a consultation, is go to drqazi.com. Our prices are on there as well, and you'll be able to see exactly how to do it and schedule a consultation that way. How often do you get patients around my age, 20 years old? Tylen's asking how often, or do I get 20-year-olds? Actually, during this season, right now, summertime, I see a lot of my patients that are in school. Sometimes I started the journey like right after college, and then they right after high school. Then they go into college, and I'm seeing them like in the summertime. I see them sometimes in the summers because that's the time that they have off for a little bit of time. And then sometimes I see them again during winter break. So I see a lot of patients your age, actually, and your age group. First of all, it's awesome. I love talking to people your age. Honestly, I love it. Because it's like, honestly, I was really lost at that age, like really lost. And it was really tough for me to figure out a lot of things. And I really got like a problem with, I found that like acne was really problematic for me. It was like really affecting my concentration at school. I was just like obsessed with it. I remember I was thinking about this other day that I would actually sometimes like, I'd feel like a pimple come out and it was like painful. And I would like leave like class in the middle of the class to go check on it and like see what was happening to my skin and see if I could stop it, because I felt that like if I didn't stop it right away, it'll get worse or so. And I remember like I had to sometimes splash like cold water on my face to like cool it down or so. And it was interesting, because like think about how many times that probably happened a lot of times actually, like in high school and then in college. So like it actually affected my concentration actually for certain things. Like having acne actually affected my concentration. And it was like, it was a really unfortunate thing when you think about it that way, that sometimes I'll sit there and like this thing is like sitting there, like I'm minding my own business. And then suddenly I start getting like a pimple that I'm feeling. And I had to leave, or I just got worried that like it's like visible and like I want to take a look and see how it looks or so. And I just remember like worrying and obsessing with it a lot like that. And I ended up just like not like concentrating and focusing as much as I wanted to. And as I was talking about on this, that like it helped a lot to get that under control and cleared, so that then I could focus so much more on these type of things, and I don't have to worry so much about other aspects now. It's like I don't have to stress and worry about things anymore. And it's really cool that I could just focus on this, and like this is my world and like my family and this, and like that's cool. It's like it's pretty nice then. It's like I don't have to stress about that much anymore. And like then it turns out there's a lot of room and like time to grow and learn, like, and whatever else you want to do without this buzzing around in the back of your head. It's like you could go and grow into something else and get better and better and better that way. Javon, are you still on? I'll answer your question if you're still on. I wasn't sure if you're still on here. I definitely was mentally, so Sailor Moon saying I definitely was mentally affected by my acne as well. Didn't want to go to school, work, events, etc. And that's something you hear over and over and over again from people that suffer from acne. And then of course, if they suffer from some scars, even mild scars, even if like whatever it is, they just find that they just aren't as social as they used to be, as social as they want to be. Because they just feel that it's not even necessarily that people are judging. It's just that they just don't want to like be seen that way. They have a certain image of themselves, certain view of how they're supposed to look. And they think that it's like, not really fair that people are going to see this way. And maybe they don't see people all the time. It's like, here's an event and it's like, gosh, like I had my period right now this week. And now it's like, I ended up at, getting a breakout right now, and there's a social event here. And that sucks because the whole month, that's a month I was fine. And now it just so happens that I have a bad flare up. And it's tough now. It's really tough to manage that. Talon saying the worst part is worrying what the lighting is around you and how it potentially looks. I've noticed my scars are like near invisible in some lights, but look crazy in others. That's a lot of times the same case that a lot of people will have, and that's the thing is that's tough because you had acne and you notice the acne, and then you think to yourself constantly that what are these scars that I'm left with, and it's a reminder of that. So, at least, you're starting now at your age, you're going to continue to get a good collagen response, which is awesome. All right, so where was I at? So I promised Javon that I'll answer this question about my pathway. Here's this thing. I'm going to get some water there first. Okay, so Javon is saying, number 1, finish residency. Number 2, start fellowship, do part-time work as an attending. What attending salary? Is it allowed to do both, or can you only do fellowship? I didn't do fellowship, but I can answer somewhat that you typically can do some moonlighting as a fellow, typically in the same hospital. It's very similar to a residency. You just essentially, as a resident, I'm not sure what your state in, but in my state in Illinois, we're allowed to moonlight at the same hospital that we're in, meaning that we could do extra shifts, almost similar to being an attending. But you have a lot of discretion to be able to do run ICUs and things like that, and capable of doing that. And then you get a higher salary for those moonlighting shifts. So if that's what you're asking, I guess that's what you're asking. But I'm not sure which world you're in right there, which pathway you're in for residency either. But fellows typically have to be within their same hospital system. That's at least the rules that were in my hospital. I'm not sure if that's the case across the country. What steps to clear these scars on dark skin? So yeah, just to kind of wrap up, because I went overboard anyways, but just a few things. We did TCA CROSS, so we did that for the boxcar scars. We did some CO2 laser around the edges of the scar. We broke up the scar tissue with Subcision. And then we did some more laser, and then we did some volumization. So we did all those things. So that's basically what we ended up doing. It seems like moonlighting is based in the hospital. Yes, exactly. And don't burn yourself out. You're gonna make enough eventually. Don't stress out too much at that time. By the way, just so you know, everyone stresses out so much, but it'll be okay. So they're asking, hey, Dr. Qazi, do you guys give any student discounts? We do for Accure. So take a look at the Accure. You'll take a. By the way, for those who are physicians, I see a lot of physicians and residents on here actually. For those who are, just pay attention. Just take a look and see that I really do think that LLMs, large language models, are gonna be things that are gonna be required for a lot of doctors at some point. And so maybe consider more procedural based things, things that really can separate yourself and differentiate yourself from other people. Maybe something to consider, because it's really going to be something where people that are pretty weak in medicine and unclear about what antibiotics to use, they're going to be really relying on those tools. And these private equity firms are going to make it so that they're not going to require as many physicians or so. You'll see. And so make yourself invaluable by really knowing something really in and out really well. Talent saying, do you think, in effect, similar to microswelling could happen with treatments? In the morning, my skin looks great, but kind of deflates during the day, revealing more scars. I think so. I think it's just so much slower than you may think, Talent, because of that volume replacement has to take a long time to look natural. And the goal is to look natural. It's actually really, really easy for me to just fill up stuff really quickly with just hyaluronic acid and just call it a day. It'll be so fast and so easy. I could show thousands of results all day long with that. The thing is that it's not going to look great over time. I just dissolved 2 huge patients that had so much filler in them. I dissolved so much filler, and hyaluronic acid draws in too much water. It's not great. So, it does work to get revolumized, but it may not look the best. So you have to go very, very slow to make sure that patients can integrate with their like natural anatomy, with the way that actually they smile, they're talking. It looks really cohesive for them, and you slowly keep doing it, and then you can end up doing that. I'm 30 right now. Is it too late to start treatment? Absolutely not. You're still very, very young. So no, you're absolutely not. It really there's no age limit to this. We've done patients in their 80s actually. There's no age limit. It's totally fine. We could absolutely do it. I appreciate everybody. Again, go give me a follow if you haven't. Feel free to also take a look at our page at drqazi.com. And hopefully that diagnosis part ended up helping out people and explaining things. I saw so many things over the last few weeks of patients that just like wanted to understand what kind of scars they had and how to treat these particular scars. And hopefully that ended up helping. Alex Carter with excisions. I could do either punch or elliptical. It just depends. It's not, you're saying, I heard elliptical excision is usually 3 times the size. And for an ice pick scar, I'd rather have a smaller. You do not do elliptical for ice pick scar. And it's not 3 times the size. Basically, inside the scar walls is where we do the elliptical. That's the best way to do it. And then we get it tighter that way. So we don't have to do that. Is Picos Pro a good laser? Yeah, it's an awesome laser. I love that laser. It's at least, I'm open to all sorts of different devices for pigmentation